Welcome back to Toledo Clinic TV. Our guest is sleep specialist Dr. Naeem Lughmani, and we are going to talk about narcolepsy, which is a sleep disorder caused by what?
So narcolepsy is a disorder more common in teenagers, and it is caused, there are actually two types. In one type we know the cause, in other types we are not fully sure. So type 1 narcolepsy is caused by deficiency of a neurotransmitter called orexin in the brain. And there is a part of the brain called hypothalamus. There are cells in there which produce orexin neurotransmitter, and it is related to alertness. So those neurotransmitters are part of our alerting system so that we can stay alert in the day. And for some reason which we think is possibly autoimmune, specifically against those neurons, that those neurons in the hypothalamus dies off, they just vanish, and then your level of orexin goes really low, and thus you start having significant symptoms of narcolepsy, which is sleepiness and certain other symptoms.
Yeah, so let's talk more about those symptoms. How would you know, or if you would suspect that you might have narcolepsy?
So in a typical patient, it's a teenager who has difficulty staying awake, has sleep attacks, uncontrollable episodes of sleep during the day. And they also have associated symptoms, which includes cataplexy. Cataplexy is a symptom where during laughter or other emotional outbursts, that patient loses their muscle tone. So their knee would buckle and they can actually fall to the floor. They can hear things, but their muscles are not moving. And that can last for a minute or more. So that's a very typical symptom of that's almost always narcolepsy with cataplexy. That's type 1 narcolepsy has that. They can have once only in their lifetime, or they can have frequent. Then there are other symptoms. One of them is called sleep paralysis. So what they do is at bedtime, they're trying to fall asleep, and suddenly they feel as if they can't move, and that can last for a few seconds or longer. Sometimes I also get a history that people they close their eyes and they fall asleep and they start dreaming right away, and then in their dream they feel locked, that it's a scary situation, they want to run and they feel paralyzed. So that's another, so sleep paralysis is another one. And then another one is called hypnagogic hallucination. That's a typical symptom of narcolepsy as well, where at bedtime you're trying to sleep and not fully asleep yet, but you start seeing things which are not there. So you have this box, one of my patients said there's a box going on the roof. Some said that they saw a dog, and somebody even felt somebody touching them, and then they got scared, and then there was nobody there when they really got up. So the reason that happens is that it is a phenomena of REM sleep. So in narcolepsy, a REM sleep gets, in a way, I call it free from a normal control. Normally, you have to fall asleep, go through stage 1, go through stage 2, go through delta sleep, deep sleep, non-REM, and then go to REM sleep. So it's padded, about 120 minutes, 90 to 120 minutes later, you get into it. With narcolepsy, that relationship is gone. It can come anytime, in the day or at night. So they can get it at night, right before they even fall asleep. So that dreaming is why they're paralyzed, because in dream sleep you're normally paralyzed. So that's why they feel that sleep paralysis, they're getting into dream sleep. And also hallucinations, really dreaming. And that happens too early, they're not even fully asleep yet. And that's what is even cataplexy, the falling with excitement, laughter, they trigger their REM sleep paralysis, which is normal in sleep. They don't never normally notice it, but then they can feel it at that time. So it's basically, people with narcolepsy have awake getting into their sleep, and in sleep getting they're awake in a way, and thus they're really sleepy in the day. At night their sleep is really fragmented.
And so what are the treatment options for those people?
So narcolepsy, once we diagnose it, the treatment is mainly symptomatic, because since we don't know exactly what causes it yet, even though we have some idea about this autoimmune thing, but that's also still a theory in a way. I mean, we have not fully confirmed it. We don't know which antibodies. So we treat symptoms. So basically, stimulants, the modafinil, armodafinil, methylphenidate, those kind of things in the day we use to keep them awake. And at night, they sometimes use sedatives. And there is another medicine called Xyrem, which is a liquid medicine, which also puts them in real good deep delta sleep at night. And that is also known to, that also causes improvement in daytime sleepiness, and even other features like cataplexy is also improved with that medicine. There are some antidepressants we use as well for cataplexy, because antidepressants reduces the level of REM, and thus less REM related symptoms, which is cataplexy, sleep paralysis, those improve with those. So medications are mainly the treatment. Some people who can't take medicine for whatever reason, there is behavioral treatment, and I have used it in some patients. They have really bad side effects from medicines. One of them is scheduled naps. So every 3 hours, 2 to 3 hours, if they schedule short naps, maybe 10 minutes, maybe 15 minutes, they get that REM out of the way, the pressing on their brain, they want to come. So, and then that refreshes them. Typically in narcolepsy, that's how one of the way we can differentiate narcolepsy is that with narcolepsy, short naps will refresh them. So they do every 3 hours, and if they can't do that, then a longer nap sometimes we do, and that helps as well.
Can you ever outgrow it, or is it something that once you have it, you'll be struggling with it?
Narcolepsy, you have it for life, yeah. So that's a struggle we have. I have lots of patients we follow, and then you have to deal with medications. These stimulant medications, you get tolerant to it, so it doesn't work no more.
Yeah.
So then you have to change it, give them drug holidays, and it does work. But most of these patients are very smart. So their school, college, once they get treated, they can do their normal things.
But it does seem terribly disruptive.
Yeah, so if they don't get treated, of course, it will affect them quite a bit.
Okay, very good. Thank you so much.
You're welcome.
We'll be right back.